Welcome to Mallett and Michelle on Dripping Springs, hosted by me, Michelle Lewis, and Steve Mallett. You're going to like this one.
I bet I don't.
Pearl button snap guy.
Yes. Look at that.
I
wonder if you can hear it.
You've expanded your wardrobe on the pearl snaps. I like it.
And Michelle Lewis, who can work at her yard for 3 straight days, but says going to the gym is too much work.
Amen. Because is there sweating involved at the gym?
But you will be out in your yard. It's only 100 degrees. I had plants to plant and mulch to put down, and I had to plant a tree. But you're okay with that?
Because I'm more about the aesthetics of other things than versus the aesthetics of my ass.
That's a gym review right there. Yeah.
Although I will get Botox every 3 months. So.
That's true. How's how things going with the oak wilt in your yard?
Oh, so we had these guys come out. They did say that our neighbor had oak wilt, their big tree, and so they took the big tree out. And then our trees were in danger. We didn't have oak wilt, but our trees were in danger of getting it. So they basically got our trees drunk. They looked like kegs.
Oh, yeah.
And then they put these little, these little infusion thingamajiggies they kind of dug around the base of it and put these little needles, I don't know what they are, all around it. Probably
they're injectors.
Okay, injectors.
Injectors, that's
they
what they
injected my tree. I was like infusion. That sounded pretty fancy.
That's probably true.
They infused my tree with vitamins and minerals. And they said that sometimes it can take as little as 24 hours, sometimes 72 hours. The ones that take longer could be more stressed. Oh. And so we had 2 of those
because they're not
trees.
absorbing it as fast.
Yeah. So we had 2 of them that kind of did that. But luckily for us, our neighbors also did it. The HOA is aware of it. So High Point is hopefully going to be proactive. We do have they confirmed that we have an oak wilt tree right when you pull out of High Point on the left-hand side the right-hand side by the gate.
Oh, really?
Yep,
so outside the gate on Sawyer Ranch
right
Road?
Before you go outside the gate of High Point, it's a big old tree, and there's a couple of trees right next to it that are stressed. But we asked them why they didn't take out these other 2 trees in our neighbor's yard that definitely had active oak wilt, and said they did it for our benefit because we're getting our trees done. If they cut those trees down, then our trees would, what's the word? Like supersonic. It would like
absorb more of the.
It would go faster.
Fungus among us through the roots.
Yeah. So, I've learned a lot about trees lately. Our red oaks, they treated our red oaks, but they said the red oaks are more systematic, where I guess it's more like branch wise. And then they were talking about the white oaks. We didn't have to worry about our crepe myrtles, obviously. So, if we lost those trees, we have almost 30 something trees in our yard. It would really change the value.
I think it would change the value of your house by $100,000.
Well, maybe it cost us $2,000.
But a lot. It would affect the value a lot. I just had all the ball moss. I have a beautiful cedar elm in front of my house. You've seen it. Mm-hmm. When I bought my house, it was only like 10 feet tall and had no canopy. Now it's just a gorgeous tree. And I had all the ball moss removed. And so I did a little research on ball moss because I wasn't quite sure. Do you know it's not a moss? You know what ball moss is,
I do, because when we first moved into our house, we've done it several times, but we've taken all that stuff out because we heard from a certified arborist, but I don't know if you can say differently, but it can, in certain instances, choke your tree out, choke the nutrients or...
So I heard the exact opposite. So it's not a parasitic plant. It's actually, it's not a moss. It's a true plant with flowers and seeds. And it attaches to the trees, but and it has a root system, but mostly for attachment. It doesn't actually absorb any nutrients or water from the tree.
So then why do your trees look like shit?
Yeah, I know. And that has always been the thing that got me, is because people go, oh, well, it doesn't hurt the trees. And I walk around and I see a live oak covered in ball moss and there's awful. Like 12 leaves on it. It looks terrible. Uh-huh. Well, what that is the ball moss, the light doesn't go through the ball moss, right? So you get a branch that has a bunch of ball moss on it. Well, it blocks out the sun from the other branches.
So my theory of saying it chokes the tree out is
that is correct, but it doesn't choke it out by absorbing the nutrients.
Interesting. Yeah.
And it's a bromeliad, and Spanish moss is a bromeliad. And you know what else is a bromeliad?
What?
Pineapples. I didn't know that.
Oh.
So ball moss is related to pineapples. And it's not, like I said, it's not a parasite. So people that think that it's absorbing stuff out of the trees, that's not true. And the only ways to get rid of it are picking it off, which is what I did, pruning the branches that are covered, because sometimes you get a branch and there's no leaves on it at all, right? You can just prune that branch, get rid of all that moss, or there is some chemicals you can spray on there. But I'd be really cautious about that because one of the articles I read said if you spray this chemical on there and you put too much, right? So it's all relative, that you can actually harm the tree. So the last thing I want to do trying to save the tree from ball moss is to, poison the tree basically.
Well, don't be lazy. Just go up there and take it off because, if you spray it, it's going to die and the ball moss is still up there. Now you have dead ball moss.
Well, I don't know if you noticed, a lot of it died during those 2 hard freezes we had. There's some trees in my neighborhood that all the ball moss is dead, but it's still there.
Where do they come from? Oh, it's
the ball moss?
Yeah. How does it get there?
It travels through the air.
Oh.
So it's got these little like flowers and the seeds travel through the air and they land on I'm showing you a picture.
Oh, that's interesting.
Yeah. And then they land on the tree and it attaches and grows out of that.
I think it looks ugly. I think that's one of the things that when I go do a pre-stage walkthrough, I'm looking at their trees and I will ask them.
Healthy trees are one of the best things you can do for property value. But yeah, it's easy to say, pull it off. But, like this tree in the front of my yard, the top branches are 30 feet in the air. And
don't be a wuss, Steve.
Yeah,
Get up on a ladder.
59-year-old Steve, he was found dead in the yard.
Oh,
yeah.
No.
Yeah. So, it is a good idea to get rid of it because it will, even though it doesn't kill it by absorbing the nutrients, it will kill your trees.
Interesting. Because I said that before that it would choke your trees out, but it never occurred to me why it would choke your trees out. I just said, it don't choke your trees out.
It does.
Don't choke your trees.
The other thing I read was it tends to be a neighborhood problem. So if you clean all the ball moss out of your trees and then your neighbor has a tree that's covered in ball moss, your tree will eventually just be covered in ball moss again.
And then your neighbor's neighbor, and then your neighbor's neighbor,
and your neighbor's neighbor. So we were talking in the office earlier, is saying that ball moss chokes out your trees and knowing that that's not true, is that gaslighting?
It does. It is true.
Okay.
Mallett.
Sorta.
We just discussed this. Is choking your tree out.
But it's not really.
It is choking your tree.
Is that gaslighting?
No, that's not gaslighting because I believe it's true and you.
You believe it's true.
Well, you just said it was true. I said choking your tree out, but it's not. I didn't specify the nature of how it's choking your tree out. It's just, it's hiding all the other little leaves so they can't get light. But no, I think gaslighting is more like saying birds aren't real.
You were talking about that. I wrote that down, but I didn't do any research. So what's going on with the...
Well, I know.
I want to talk about gaslighting and I want to talk about how that term came about. But tell me about the birds are not real.
I think it falls into the whole gaslighting like play. But so back in 2017, there were all these screaming because somebody was elected president and one group of people didn't like it.
Blah, blah,
blah. And so there were all these protests, right? Well, this kid from Tennessee, I guess he was sitting in his condo or his dorm or whatever, and he was seeing these protesters. And he saw like a whole subsect of protesters that didn't have anything to do with the original protests. And so he was like, I guess he was bored, and he went down there and made a sign that said, "Birds aren't real." And so people started coming to him, and he was literally just making it up as he went along. And one of the things that he was saying, was that,
there's a picture of him right there. It's got a giant sign that says "Birds aren't real."
Birds aren't real. Yeah. So he was just kind of saying, well,
next to a guy dressed up as Big Bird.
Oh, yeah, it is Big Bird. But it was filmed on Facebook, but he was saying that all the birds have been replaced by drones and that the government is watching you. And so the conspiracy theorists then took that and kind of ran with it. And basically one of the quotes that he said is, "We were able to construct an entirely fictional world that was reported on as fact by local media and the public." And they just kind of perpetuated this BS joke over and over and over again. They have over 1 million followers on Instagram, Facebook. There was like this
You're kidding.
There's T-shirts. There's a whole little thing. But I think to the bigger problem is he went out there. It was satire, right?
Mm-hmm.
And the media or whomever took it as gospel and ran with it, and hence now gaslighting. And we can kind of fall into, and I think that's exactly.
Well, that is a great example of gaslighting, where the media says, "Hey, there's this great news story. It was just a joke."
Yeah, it was just a total joke.
These crazy people that are on this side of the aisle, the right side or the left, they believe that birds aren't real and they're drones and they're flying around and spying in your bedroom.
I think that gaslighting, and you may, I don't know if you've done a little research on this, but like, why did this word kind of come about? And I think that you're not a TikToker, and I'm not really a TikToker, but I do watch. TikTok. Be very scared. But I think these younger generation millennials have taken a word like gaslighting, like toxic. There's a couple of other words that they're using, and they have brought to light, good or bad, look, if everybody grew up in a toxic family, if everybody grew up where their mother's gaslighting them, then, what's making the world go round? It's to me, it's infuriating. It is
infuriating. So the term gaslighting, do you know where that even comes from?
No, I actually don't.
I actually thought this was fascinating. There was a play in 1938 called Gaslight that was made into a movie.
So it's been around that long.
Yeah, in 1940 and 1944. So it made into the same movie twice, different, but the same, whatever, screenplay.
Uh-huh.
And it was about a husband who wanted to drive his wife insane so he could put her in a home and go run off with his girlfriend or whatever.
It's slowly what I'm doing to you.
Yes, it is. It's exactly what you're doing to me. But what he did was he would come home every night before she got home, and this was before electric lights in the house. They had gas lights. And he would turn down the lights a little bit in the house, and she would come home and she'd say, "Hey, the house is darker." And he's like, "No, the house is not darker. You're losing your mind." And then the next day he'd turn it down a little more. And then every time she would say, "Something's not right," he would say, you're not all there. You are losing your mind. And eventually he drove her insane. So that's where the term gaslighting comes from. It's actually used as a psychological term now.
Huh.
I read an article in Psychology Today about it. So it is telling something to somebody that they have a problem, or they're not seeing things clearly, so that the person that's doing the telling gets some kind of economic or some kind of advantage on the other person. So
like raising a 15, 16-year-old girl who was perfect about gaslighting me when she was younger.
Yes, exactly.
She
like
would
that.
say, "You're so dramatic, Mom. You're so overreacting."
Well, that's exactly right. That's not one that is as harmful as some of the stuff that's going on today.
Well, yeah, there's relationshipable. You're welcome.
Yeah, ooh, there you go. Michelle word.
Relationship gaslighting. There's media gaslighting. There's just all sorts. But I mean, like the things that I have heard, it's like denying conversations or events that ever even happened.
Yep, that's
and it's
a big
like,
one.
well, wait a minute, or feeling the need that you feel like you have to defend your own reality.
Mm-hmm.
That's where I feel like I'm at right now with this political climate and whatever's
I'm
going on.
with you,
I'm like,
yeah.
What the hell is going on in this world right now? What is going on?
Well, and stuff that anybody with common sense knows is true is we're being told on many, many levels, no, that's not true. And then if you say, no, this is a truth.
You're a conspiracy theorist.
You're a conspiracy theorist, or you lose your job, or you're destroyed in the media.
You're canceled.
Yeah. I thought I had a couple of examples of gaslighting. One of them was, remember Dr. Fauci when the whole, I know you've rolled your eyes, when the whole pandemic started, and the first 2 weeks or something is like, no, don't wear a mask. You don't need a mask. Everything's okay. It's silly to wear a mask. And then 2 weeks later, he said, "Oh yeah, you need to wear a mask." And people were like, "Well, wait a minute. You just said we didn't need to wear a mask." And he said, "Yeah, but I was telling you that at the time because I didn't want people to have a run on masks." So and the media ran with that.
Do you think that's gaslighting, or do you think that now I have more information, I can be more educated on something? Because I think that at some point, at the beginning of this pandemic, none of us knew what the heck is going on, right? But then as more and more information came out, we got more and more information.
Well,
so think about like Roe v. Wade that's going on right now.
Oh gosh, don't go down
I'm
that
telling
road,
you though,
Michelle.
but the same thing. It's like you have more information now than you had in the 70s, right? More and more information. So is that gaslighting or is that just more information that you have? I mean,
there is more information out there on all kinds of topics, on all kinds of things. There's more information now so people can make better decisions. I see that sometimes in the media, things are brought to the forefront to distract from other things.
Oh, hell yeah. Look over here. Don't look over here.
Yeah. So I'm not saying that Roe v. Wade is this, but right now our economy has some very strong headwinds, inflation, interest rates, gas prices. They're talking about gas prices in certain states being $10 a gallon.
I don't even see how we could sustain that. I don't. If anybody from Monday through Friday is driving into dripping, it would be, we'd have to have carpools.
Yeah. But there's all these, the stock market is approaching bear territory, which means it's, I think it's two quarters with more than or 20% correction from the high in one quarter. That's what it is. 20% correction in one quarter.
We're never going to be able to retire. I
give up on that. But there's all these headwinds, and then all of a sudden everybody loses their mind about Roe v. Wade, and they're like, well, they're not worried about it. Inflation being almost 9%, which means that your $1,000 that you have in the bank is in the last few months is worth $9,100.
That's kind of what's been going on all over. It's like, I'm going to just say it, but somebody's laptop, information that's on somebody's laptop, we're not paying attention to any of that. We're paying attention to other stuff.
You were getting majorly political today.
I'm just like,
yeah.
I'm not a gaslighting person. Maybe I don't know.
And I think there are some people that there are truths in the world, and there are people out there that it's gaslighting to say, no, there's your truth and there's my truth. Yeah. No, there's some things. 2 + 2 equals 4. I don't care what planet you're on. I don't care where you are in life. I don't care what your political ideology is. 2 + 2 is 4.
I was reading, I guess in a relationship wise, if you feel like you're being gaslit, some of the responses that you can give. And one of them was, my feelings are not up for debate.
Yeah.
And so that's something you could say, or if I've heard your point multiple times, but I still don't agree. And I'm like, okay, well, I know.
It takes a strong person though. Not everybody's strong.
I know. And I know what I've experienced. So thank you. And I've had to use that before. I will not respond to name calling or yelling. I think somebody has said that to me before, but
yeah, but the I would think most of the one-on-one gaslighting, like relationship gaslighting, either at work or in a romantic relationship or a husband-wife spouse, is probably done for just to get so one person has more control.
Well, it's all about, bottom line, it's all about manipulation.
Yes, right. And the other person has to be strong enough to stand up to that. And if you're beaten down enough, you actually have less reserve to stand up and go, no, I don't believe that. I believe you've been turning down the lights in the house at night to drive me insane. It takes a stronger person to do that. And you don't have that if you're that beaten down.
I'm all about having differing opinion conversations.
Me too.
Right? But what I believe is what I believe. And I think I said this a couple podcasts ago. What I believe is what I believe, and what you believe is what you believe. My life experiences have led me to my belief. But if facts are presented to me otherwise, if there are things that are going on in the world right now, in this United States of America right now, that I truly don't understand what the end game is. I do not
agree with
understand.
That. And what you just started saying was you have things you believe in and somebody else has something they believe in. Where we've gotten off track is the person that believes something else than what you believe believes that you should be forced to believe what they believe. Yeah. That's a new concept.
That was the whole
You should be forced to believe what I believe. Yeah. That's wrong. But here's some other examples of gaslighting. The media, there's certain people in the media that talk very favorably about communism. Do you know that communism was responsible for the death of 100 million people in the 20th century?
And
they treat their citizens like slaves.
I was reading something about gaslighting, and I have always, over the last couple of years, I said, where is Walter Cronkite when we need him? And I read something, I need to look it up. I read something about Walter Cronkite, how he perpetuated or repeated this communist. I need to look it up.
You probably need to look that up before you just.
No. I
have heard some conspiracy stuff about that, but I don't know.
But when I was reading the whole gaslighting in the media, I was reading gaslighting in the media, and
how about this one? Mostly peaceful protests while there's a building burning behind the reporter.
Oh,
that's gaslighting, right?
Yeah, that's totally gaslighting.
If anything is on fire, you cannot say mostly peaceful.
Yeah,
I don't care what it is. If it's a trash can, that's not mostly peaceful.
Here, I found
that's gaslighting.
That's 100% gaslighting. Decades, America's media elites have engaged in selective gaslighting. A prime example occurred in 1968 when CBS's Walter Cronkite and others parroted communist propaganda that Americans in South Vietnamese lost the Tet offense.
Tet offensive.
Oh, sorry. Did I say offense? Yeah, offensive. In actuality, the Viet Cong were devastated despite aid from North Vietnam, but the false reports of a major American defeat morphed into a mantra that the war was unwinnable.
Wow.
So when I read that, I was like, oh, that's interesting.
That was the Vietnam War.
But, I guess, people always say, oh, well, in my time, we didn't do it. Like, we all have our issues. We all have problems.
No, every generation and every decade has had different things that somebody read a book and told me that Abraham Lincoln was, affected by it wasn't called gaslighting in this conversation, but people telling lies about him that were completely untrue, and then people believed him.
Well, that I told you the other day when I was in North Austin, Abraham Lincoln tried to wash my windshield. Remember?
You did.
There was homeless Abraham
Did he rub
Lincoln.
His beard on your windshield?
I was like, don't touch my car. And then I texted you, I hate the north side.
Yeah.
I hate it up here.
Well, that's gaslighting. I think it's a fascinating thing that is going on, and I hope people are a little bit skeptical about especially on social media.
Question
If you see something on social media and you go, gosh, that just doesn't sound right, do a little research on it. Don't take it for granted, and don't just go, well, my tribe is saying such and such and such, and so I'm going to just parrot whatever they say. Go do your own research, come up with your own ideas,
verbatim.
Come up with your own your truth. Come up with your own truth based on the facts. Don't take, especially social media.
Well, speaking of social media, we're going to have Dr. Lewis, Kevin Lewis of Lewis Family Medicine in here. And, I want to ask him about this because a couple of times, you have an experience at a doctor's office and they've been raked over the coals within social media. And, every office experiences issues. I've known Kevin and Michelle for a long, long time. But, social media is the devil. It is the necessary evil devil from
There's very little good, I think, coming out of social media, unfortunately.
I know.
And I believe that if it wasn't a necessary part of what we do for a living, I probably wouldn't be on social media at all, except for I would have an account with, you'd be on there and my family and friends, and because I want to post pictures. Here we are at the beach or whatever. But all this other stuff, I've got no
I read
use for
something the other day. It said if Instagram would tell us our friends' birthdays, we would all get off of Facebook because it stopped being about sharing memories and events in your life. It's become a cesspool of just fighting with people and disagreeing with people. And
it's sad.
It is sad. It is sad. But let's get Kevin in here.
I'm excited. We're going to take a quick little break and get Kevin in here, and we're going to visit with him for a while. So sit tight.
This show is brought to you in part by the Mallett Integrity Team, serving Dripping Springs, Austin, and the surrounding areas of Central Texas since 2004. When you need the best real estate advice and service, give them a call at 512-829-2062 or email them at mallettintegrityteam.com.
All right, welcome back. We're here with Dr. Lewis.
Hello.
Welcome to the show.
Thank you very much.
Yeah.
Happy to be here.
When did you move to Dripping Springs?
My parents moved here when I was in high school, my senior year, and then so that would have been in 95, 96. And then I went off to college and then medical school and then moved back to Austin in 2006 and started my residency at Brackenridge Hospital downtown, which is no longer even there.
And you're a
Brackenridge is gone?
Yeah, Brack's gone.
I didn't know that.
Yeah.
Steve.
Yeah.
He also thinks George Strait is dead too.
Well, that means you haven't been downtown in a while.
I haven't been. Wasn't Brackenridge the place where all the gunshot wounds went?
Yes, sir.
Traumatic injuries.
Level 1 trauma center while I was there, and so we saw everything.
Yeah.
It was a good training, and
I bet.
And so it was good.
Doesn't really prepare you for life in Dripping Springs. Probably don't get too many gunshot wounds out here, do you?
No.
Only on the neighbor's page.
Yeah.
Yeah.
So you're a third generation physician.
That's right. My dad's grandfather was a physician and surgeon up in Brownfield, Texas. And then my dad is a family medicine physician still practicing in South Austin. And then there's me.
Yeah.
So
did you know you were going to be a doctor early on?
I kind of had a scope that I kind of wanted to get into it just because it's what my dad did.
Yeah.
And I enjoyed it. And then probably my character trait that goes along with it is I like to help people. And so it's a great field to go into. And I was good in math and science. And so I kind of made the final decision that I was pushing hard for medical school, my sophomore year of school. And
Sophomore year of
college. Yeah.
Okay.
So I didn't really start out pre-med, but I was taking all the classes in case. So
Where'd you go to medical school?
University of North Texas Health Science Center in Fort Worth.
Okay.
Great school.
Is it? Yeah. Did you enjoy that? Did you going to school up there for that?
Yeah, it's awesome. I mean, Fort Worth is, in my opinion, one of the nicest towns or cities in Texas. Met my wife there and her family, and that was great. And it's just where the campus is literally right in the middle of the cultural district. So you've got the Rodeo Coliseum, you've got museums, and then right across the river are great restaurants and
cool.
downtown. So, and you're up on a hill, and we used to study in the library, and it overlooked downtown. So it was
wow,
perfect.
Yeah,
and there was a balcony you could go out on. So
that's cool.
Well, and just to clarify, his wife is Michelle Lewis, and it's not me.
I know. That's funny, isn't it?
So Michelle will call me and go, "Hey, Michelle, it's Michelle Lewis." I'm like, "Hey, Michelle Lewis, it's Michelle Lewis."
And I used to text you all the time on accident.
You still text me. He'll say, "Michelle, can you please put the kids to bed?" And I'm like, "If you want me to go to your house and put your kids to bed, I will put your kids to bed."
As long as it's nothing else, right?
I told him, I said, "Please put in your phone, Michelle, not wife,
it's in there.
Lewis."
Michelle, not
That's
wife.
exactly what it is.
Well, because my oldest son, Logan, he was your MA for what, 5 years? Something
about
like
5
that?
years. Great kid.
Yeah,
give or
he's a
take.
good guy.
He's he has big plans to kind of semi-follow in your footsteps.
That's right.
And
That's right. I think he's starting up at the clinic doing some observations.
he's going to be back
shadowing.
in there next month. So you're a great mentor for him, and we really appreciate it.
Good kid.
Yeah,
Good kid.
he is a great kid. So then you now have 3 locations, basically. Well, you have the one on Sawyer Ranch, which is 2 things.
Right. It's family medicine and urgent care. Then we have a family medicine and urgent care in Onion Creek.
Oh, so 4 basically.
Well, they're kind of the same location. And then in Manor, we have a family medicine off Shadow Glen Boulevard. So, and that area is crazy.
Is it?
Crazy growing. Yeah.
Huh. What made you want? Because it seems like doctors kind of go in one of 2 many directions, I guess. But they go like work for a big hospital corporation, or they go out in their own practice. What made you want to go private practice?
So my dad's was in private practice up until about 2 or 3 years ago, and then now he works for WellMed. But just seeing him do it, and it's just what I was always taught to do. Be your own boss, and you control the variables, you control the atmosphere, you control the lateral movement. And one of the things that I like about it is the charitable side of it. Somebody comes in and can't afford to be seen, or you can tell they're struggling. You just can write off that visit and see them for free, and our providers know that. And so after getting into it, I don't know if I was ignorant or ambitious or a combination of both, but it's a lot of work. But I think the benefits are there to have some control over your schedule, to have some control over your destiny. And I think it makes for a little better healthcare when you're able to make decisions based on your patients. And your belief in medicine and nutrition, and that you're not having to follow protocols, or you're not allowed to do this or not allowed to do that. So
a lot of those hospitals, they're real top heavy down. They sort of dictate and mandate how you treat your patients.
Yeah, well, it's just the nature of corporate medicine, that if you go to a clinic that has a provider there, they're still making their own medical decisions, but there's definitely influence of what the bosses want. Yeah. And that's based on medical legal and based on risk reduction for controversial issues. Yeah. And, to be able to wade through that with each individual patient one by one, for me, is just a better place to go to sleep at night. Yeah. And I know that I'm being true to that patient. So I didn't really think all that through before I did it. I just thought, I'm going to start a clinic like my dad did.
I want to know how difficult it is, because you are a resident of Dripping Springs, but how difficult is it to live in the community that you also service? Given there's been just crap sometimes on Facebook, on the Dripping Springs neighbors, and it's so different practicing medicine nowadays when somebody can just go on a social media site and they had some crappy day or whatever, and they can rake your name across the coals. And so, but then yet you're still raising your children in this town, and you're still at the grocery store and Valero and whatever else. So what was that conscious decision to kind of raise your kids here and open your clinic here?
Well, I grew up kind of around this area. I had friends that went to Dripping Springs, and I graduated from Great Hills Baptist Academy, which is up north, but my parents moved out here. And so I started, when I was in medical school, my junior year, I kind of had an idea, kind of a premonition from the Lord that, like, look, why don't you go back out to that area and serve? It's great people. It's growing. Mm-hmm. And my parents had just bought 64, 65 acres, however many acres they have out there, and built a house. And so that was the first time I had an idea to do it. To answer your question about social media, that was something that, nobody prepared you for in my generation. I think that
it's even worse for me.
I think that that is a tricky thing for doctors, because our purpose on earth is to help people. Mm-hmm. And we have to have staff to do that. And sometimes things don't go well between staff and a patient, and it doesn't mean that we don't love them and don't want to do the very best for them. And, it hurts, when you see a really kind of nasty, ugly post, and you're like, my goodness, if I would have just been able to talk to that person, we'd figure it out. And I don't understand it. I wasn't raised that way. I was raised to confront an issue. If you really have one, you go to the leadership and discuss it. I've never posted a bad post about anything ever. I'm not even on social media. My wife has wanted to, being a Latin, having a temper. And I won't let her do it, even at a restaurant. I'm like, look, these people have to make a living. The servers have to make a living. It's just...
Everybody has a bad day, too. So things go wrong sometimes, and things even out of your control.
You don't want to be putting out fires when you're called to be serving your patients and serving your community.
That's right.
And I think that's kind of the whole point of this podcast for us, is to get to know leaders in our community, and that you're a dad. You have 2 kids, 2 beautiful kids, and you're married. You've been married to Michelle for almost 16 years now. Right. And
people lose track. That's the thing that we've been trying to do, is that everybody has like a singular face in the community. Mm-hmm. You're a doctor, and we had the mayor on, and he's the mayor. But there's all these things about you that people don't know. And once they see you as a real person and know where you grew up and how you came to this community, then they go, oh, then they're less likely to say something like that, real nasty.
Well, you're a leader in your office as well, and aside from the issue that you guys have staffing issues like everybody else. I mean, who the hell wants to drive out to Dripping Springs, and there's not a lot of people that your support staff that kind of live in Dripping Springs. They're having to drive out from other areas, right?
That's right. For the last 2 years, it has been an uphill battle just to stay staffed. I believe we may be closed one day during COVID. During the ice freeze, I was out of state, but I got on and did telemedicine, just to service the community for people that were stuck at home and had issues going on. I just think social media can be very dangerous, and I think it should be used for positivity. I'm not on it again, but you could do so much more with positive comments and positive communication as opposed to, derogatory comments put on to somebody that's in the community, whether it's me or the mayor or somebody else who's actually trying to make things better and survive through the chaos.
And you can't make everybody happy. No matter what you do, some people are going to be unhappy. Unfortunately, the ones that are unhappy tend to be the most vocal.
Yeah.
The loudest.
And you did mention COVID. Speaking of your COVID response, I think that Lewis Family Medicine was amazing for your COVID response. And in addition to that, you've offered physicals at the high school. I just heard your name mentioned at Patriots Hall. I guess you're going to be involved in something like that. I know you're involved with Doctors Without Borders. You've been kind of all over. And this is your passion. This is what you do. And COVID just kind of took everything that you knew about medicine and turned it upside down.
It did. And, I have to say, I was really proud of our staff and providers that we all worked to get through it together. There was, to be honest with you, there was some fear because we didn't really know what we were dealing with. It was a complex reorganization of the way we do medicine to integrate telemedicine immediately and kind of profoundly, and then also then have a kind of a curbside medicine.
Yeah.
Which is hard on staff. I mean, can you imagine going out in the sleet and rain and trying to get a history on somebody because they're in their car and they can't come in, but we still need to take a listen to their lungs.
Yeah.
And then, then the provider has to put on full protective equipment and go out and examine them.
You said that provider. What's the difference between staff and providers?
So providers are going to be either a doctor, PA, physician assistant, or nurse practitioner.
Oh, okay.
I think Logan's looking at doing PA.
Uh-huh.
Yeah. It's a good choice.
Yeah. The how do you think the national response to the whole COVID thing was? Now looking back, I mean, hindsight's always 20/20, but
I really feel like in 2 or 3 years we'll have better hindsight.
Mm-hmm.
I felt like there was a lot of, and I lost my best friend to it a year ago, last month. Ralph Macchio, great guy, and so I was directly affected, but I still feel like there's a lot of hysterical kind of ramped up, and I don't know if that was general public or some of that might have been fueled from even the medicine world itself. I just think that when we have crises happen, whether it's in the office and it's an acute chest pain or somebody falls and is unconscious in the parking lot, or you have a pandemic, you need to move, cautiously and even-tempered and evaluate the situation. And so for our clinic, we kind of looked at everything and came up with some protocols of what to do to keep patients out of the clinic, which is why we opened up the COVID testing trailer, which was an ordeal in of itself. But, the thought process behind that was just trying to get people out of the clinic that just wanted to get tested so that we wouldn't expose staff in the exam rooms to somebody that was positive. But overall, I don't have a strong opinion one way or the other. Mm-hmm. I think that we really could have operated with cooler heads and looked at numbers a little bit deeper. And I definitely think it was politicized on both sides of the aisle. That being said, our job was still the same, to take care of our patients and keep them out of the hospital. And I think we did a good job at that.
What does it look like now, though? I mean, do you think that your COVID response now, obviously it's a lot different than it was a year ago, but are people or physicians starting to look at it more like a flu versus just some pandemic type, oh my gosh, put full PPE on and close your windows up and fully sanitize after you've come in contact?
So the newer strains that have been coming out are trending towards like an antigenic drift of having less severe symptoms.
Okay.
And so people in general, it's a very interesting psychosocial evaluation. I mean, the public's not even reacting. I read yesterday that California has doubled in its number of cases. but you're not seeing the hysteria that we saw with round 2 or round 3. And so there's a lot of components, and a lot of it is how is the society reacting to it in a given region. And in this region, to be honest with you, people were pretty level-headed about
Pretty
it.
tame.
And I think that from our standpoint, our protocols have kind of stayed the same. And we still have respect for the situation. But I mean, people die from the flu every year.
Yeah. People
die from pneumonia every year. And not to minimize COVID and the new threat that it was, we kind of just got to stay the course. And so I do see things are better. I mean, you could just look around and everybody's going to football games and baseball games. And my son, is playing lacrosse and things are getting back to normal.
Yeah.
But I don't
Whatever
think
that is.
Yeah.
Right. So
the most important question of the day, though, is what the hell is monkeypox, and should we be scared?
You're a monkeypox.
Well, you got your vaccines when you were younger, your childhood vaccines.
I did.
I hear it's similar to a smallpox.
Right,
correct? Okay.
right. And so I haven't read a ton about it just yet. It's kind of new. I read a little bit yesterday that on how it's transmitted and some different things, but I haven't dug deep into that. I'm hopeful we won't see a lot of that out here.
Well, then the takeaway I'll have from that then is that we probably shouldn't be as worried as social media is telling us we should be.
We're all going to die.
Yeah. That's the latest, the scare du jour, it seems like.
Well, I think that it's interesting, right? It's like now we can track everything.
Yeah.
And you can communicate that tracking with the entire world through a tweet. Yeah. And then that gets retweeted. Uh-huh. And so, if we had the social media presence that we had today when H1N1 came out, that would have been a whole different. That would have been a whole different thing. And I remember that because I was in residency and Michelle was pregnant with Eliana. And so I was having to decide, or Michelle and I together, were we going to get her the vaccine for H1N1 that was rushed? I don't know if you remember that, but they kind of ramped it up. And I went and talked to about 8 of my overseeing physicians at the residency program, and pretty much all 8 were like, I would get it. And so really? we prayed about it and we got it. And, that's kind of the advice I give patients. You got to pray about your health decisions. And when you've got something that you feel like is a difficult decision, that's something that you have to get comfortable with.
I wanted to ask about H1N1 versus COVID. Were they similar in how deadly they were and how transmissible they were?
I believe I couldn't answer that with accuracy and numbers. I haven't reviewed those in years, but it was they were predicting at least that H1N1 was going to be a big deal, and it didn't play out to the numbers that they projected back then. But it was definitely a thing, and there were definitely people that got really, really sick from it.
Because social media wasn't that big of a thing then.
That's kind of what I was getting to. Is I wonder how much of this was hype, where everybody was just lathered up about it.
Speaking of scare tactics, I do know from experience that you're a big prankster. And Logan told me a story about one time you hiding a fake rattlesnake in the cabinet.
It wasn't fake. It was stuffed.
Oh, jeez.
So tell us the story.
And coiled up. So I don't know what was going on. I was online and I was like, oh my gosh, I'm going to buy this rattlesnake. And I put it in the microwave.
Oh, geez.
And I'd ask staff, I'd be like, hey, Lisa, can you go get my food out of the microwave for me? And then you'd hear a loud scream. And I don't know, somebody got rid of that thing, and I have no clue where it's
going to come up. You're going to sit on the toilet one day, and it's going to be floating in the toilet.
Sierra's been saving it for you, I'm sure.
Yeah, it's somewhere, somebody's house, sitting on their bedside.
It will come back, I'm sure. So. Where'd you get that where you like to do pranks? How'd you pick that up?
I grew up, my dad's a big joker.
Is he?
Yeah, and he's always doing crazy stuff. Great man. He grew up pulling pranks on us, and then we started pranking everybody else. And I'm probably, out of all the kids, I was the biggest.
That's fun.
Biggest guy to get into pranks. I just love to see people laugh in funny situations, and I have an awkward sense of humor as well. Like I have a prank called the double blind, which is where you get like, let's say that y'all didn't like each other. Well, Michelle and I would send y'all an invitation to go to dinner with us. You, Michelle, and then we'd send you one, but we'd have a table for 4.
Oh,
and then we just back out.
Oh, geez.
And then you're sitting there like, what are we doing here?
It's like dinner with idiots. You remember that? Yeah. That's funny.
Oh man.
Ooh,
well,
Steve,
now I know.
Let's do it.
And Kevin never calls me and says, "Hey, you want to go out to dinner?" No, I'm not going out to dinner.
Yeah.
What's the? I want to talk a little bit about medicine, but what's some of the things you wish every one of your patients knew when they walked in the door?
Number one, that the providers and our staff, we care about them and want to do a great job. Number two, from a medical aspect, we're really big on heart health at our office and advanced lipid panels, cardiac calcium scores. 52% of the people that end up admitted to any hospital system have LDLs less than 100. And there's still, it's not super mainstream for people to be doing advanced lipid panels. I mean, what advanced lipid panels are their newer markers that have been developed, like the Cleveland Heart Institute does them. That's where we primarily send ours. And they tell you more information about the plaque and what's going on at the plaque level at the endothelium of the arteries of the heart. That with a calcium score is, once you've done those things, you've done pretty much everything you can do until you have a symptom of shortness of breath with exertion or getting short of breath going up or down stairs that you feel like is new or different. And then you can push with the stress test. And I think that these will be mainstream here in the next 5 to 7 years, where it's just going to be part of your general physical. So that's a big thing for us. We do a lot of hormone health with men and women. I mean, a lot of 40 to 50-year-old women have fatigue, difficulty losing weight, decreased energy levels. A lot of times that can be significantly improved with HRT or hormone replacement therapy. And the same thing for men.
Is that TRT for men?
Yeah.
Testosterone replacement therapy?
Thankfully for us, we just have one that we have to replace.
Yeah.
So is that the whole argument for the osteopathic medicine versus MD? I mean, I think there's a lot of people that don't understand the differences between kind of the kind of medicine that you practice. So
the first way to understand the difference between a DO or an MD is they're both fully licensed medical doctors in the United States. You have DO pediatric doctors, you have DO neurosurgeons, you have DO orthopedic surgeons, and you're starting to see less adversarial kind of viewpoints from the MDs because they're starting to realize, well, holistic medicine is a better medicine. And the osteopathic principles kind of incorporate mind, body, soul into the treatment, right? And part of it, and there's a lot about structure and function. So the superficial way to understand it is if you took a very, very well-known and good chiropractic school, and you put it on top. Put it on top of a MD medical school. Okay. That's an osteopathic physician. So we learn a lot more. I can't remember exactly how many more hours it is, 200 or 300 extra hours of structure, function, manipulation, and treatments to treat the lymphatic system, to treat many different things.
One of the things I hear when I'm talking to my friends is that when you go to the doctor now, and we could be completely off base, that typically the symptoms are more treated than the actual cause. I know that's probably a layman's view of something you understand a lot more than we do, but it seems like you go to the doctor now, and then here's the pill to fix
for your headache. Here's the pill for your headache versus what is
why
caused.
Am I getting the headache? Yeah. Is that tell people why that is and what's going on there?
So I think historically that's been the case, and I think there's many variables that play into that. I think that doctors inherently want to solve the problem, and getting you feeling better really is satisfying to a doctor. But understanding what caused that is just as important.
Yeah.
And, to give an example, when my dad was in his intern year up in Fort Worth, he got called to the hospital to evaluate a guy with chest pain. And he started looking through the record back then to paper charts. And this was like his 4th workup in like 4 months for chest pain. And he was sent home every time, given morphine and sent home with pain meds and muscle relaxers. So my dad decides, I'm going to do an exam of his spine, cervical and thoracic, and see what's going on. Well, he had a rib head out of place.
Oh, geez.
And it was kind of subluxing and getting out of place, and it's putting pressure on the nerve root, which is simulating his chest pain.
Oh,
So my dad, put the rib head back in place, and the guy's pain went away.
Wow.
And so that's like a prime example that I share with people of an osteopathic doctor and getting, like you said, to the root problem, because this guy was his fourth time in the hospital, was given morphine every time and sent home with pain meds, which could create a whole other set of problems.
Yeah.
And so it is important to get to the root. And like with chronic headaches, sometimes it's just a OA dysfunction of the occipital atlas, joint that needs to be addressed.
And so then I think the lesson I would take away from that is when you go into the doc and the doc says, well, here, take these pills, this will make this go away. Then it's up to the patient to say, well, wait a minute. I need to know why this is happening, right?
Right. What can I do to, take gout, for example.
Yeah.
You can affect your gout flares by significant dietary changes. And a lot of times doctors will kind of move past that and just treat it. Well, you do need to treat the acute flare, but you got to educate about how to prevent that. You can't change the genetics and the enzymes that somebody has that predisposes them to gout, but you can definitely advise them to change their diet. And some people won't, some people will, but you got to address that for sure.
What's there's all these like trendy diets now, keto and low fat, low carb. What is
The Deep Eddy vodka diet.
the Deep Eddy vodka diet? The typical, I'm 59. What's the typical 59-year-old guy? I know we shouldn't be eating hamburgers and French fries for every meal, but like what kind of diet should we be looking to have?
I think that most of the cardiologists in town and myself, we kind of default to a Mediterranean style diet. We know it's healthy. There's studies that prove that it's healthy. When I'm explaining to somebody and they have no idea what the Mediterranean diet is, I basically tell them, make the triangle that we all grew up looking at, and then forget everything that was on there previously and make 80% of it vegetables and healthy protein like chicken and fish.
Okay.
And then in the other 20%, healthy grains like quinoa and fibers and things that you just inherently know are healthy for you. And you're going to have to put a little bit of carbs in there, but you can stick with healthier carbs. And so that's the two ways that I kind of share with my patients to look at their diet, and then getting physical activity, you're recommending, 15 to 20 minutes of anaerobic cardiopulmonary exercise, like stationary bikes. I think Peloton is a game changer for this. And then if you're not doing Peloton, they're recommending about 150 minutes of just weightlifting, aerobic exercise, whether that's walking around the block or lifting weights or just staying active.
I want to ask about adolescent health and how that has really kind of changed and the problems that you're facing now versus when we were kids, when we were growing up. And this is some scary shit that's out there. Not only is the vaping and the anxiety levels that are going on, but this fentanyl crisis that is hitting, things that are being laced, that these kids are taking other people's Adderall and it's being laced with something. And,
Are you seeing some of that stuff?
Yeah, we are. I haven't had that's not true. I did have a patient that, we have had some patients come in that have ended up dependent on fentanyl because they're taking what they thought was like just basic hydrocodone. Oh. And, even getting respiratory suppression and things like that. So it's a real deal. It's going to be real anywhere you go. It doesn't matter if it's Dripping or Westlake or Lake Travis, maybe more so in these locations because of
the wealth factor.
The wealth factor. And it's complicated. I will say that this has to be on the forefront of our agendas and mindsets at the schools. And we can't assume that our kids aren't the ones doing it. The reality and statistics would prove otherwise. And so it's dangerous. The levels of anxiety, depression that I'm seeing at younger ages, I've definitely seen a trend towards that being more prominent even before COVID hit. And more so the social stressors at school. And I'd have to say more so for young females than males, but both sides. And, it's disheartening. And the one thing that Michelle and I have taken away from that, and we've watched many presentations and documentaries, is our kids don't have phones. I'm not an anti-phone guy, but I'll just tell you, even my daughter who's 12 is nowhere near mature enough to have a phone. I can just see her getting her heart broke, or somebody sending her a nasty text that's, that just crushes her. Like she doesn't have the skill set yet to deal with that. And so,
hey, I'm 51. I don't have skills.
I know. It's true.
me neither.
Yeah, I know. That's true. Well, you were just talking about that. One of the things I was going to ask you about is antidepressants. It seems to me like the antidepressants prescriptions have really increased. Is that true?
Yeah. Yes, sir.
And what's your take on that? Are we prescribing them properly? Are we over prescribing them?
I think that's going to be real clinic dependent. And what you can kind of clump ADD, ADHD medications into this.
Okay.
The conversation has to be held between the parents. Like, what state do you feel like your kid's in? Because nobody knows that kid like the parents.
Sure.
And then teachers' input is pretty big. How's the kid doing at school? Do you feel like they're disengaged? Do you see depressive symptoms that you're looking at them and your heart hurts for them? Because when you're looking at medications, definitely there are children and young adults that need to be on medications to stabilize. And it may be for a period of time, and then they end up growing through that and developing coping skills to get off that medication. So it's what's being done across the board. Yeah, I think that there's some doctors that don't really get involved and kind of intimately know their family that they're taking care of, which is a leg up that I have. I take care of so many entire families that
from babies to geriatric.
That I'll get a dad just text me on a Friday night and we'll talk 15, 20 minutes on the phone. He'll give me a heads up. My daughter's coming in to see you on Monday. And here's what we're dealing with. And then I get a different story from the daughter because she's younger and her perspective is different. But I have both sets of knowledge to then say, and the other thing that I try to do is, what would I do if this was my daughter? Would I put her on meds?
Yeah.
Or would I wait and do some cognitive behavioral therapy, get some counseling, maybe family counseling? What would I do before I put my kid on meds?
What's cognitive behavioral therapy?
Just counseling.
Oh, yeah.
Yeah. Where they're teaching you how to cope and deal with different stressors and even how to avoid stuff. Like if you get stressed out every day going to the lunchroom and trying to figure out what table to sit at.
Don't go to lunchroom.
You're insecure.
Bring your lunch with you and sit outside.
Find one friend and go sit out under a tree.
Yeah.
I can tell you my daughter, when she was 16, 17 years old, and the pressures and the stress that she would put on her own self, and then from friends, being cheerleader or whatever else, and who she is today, even only being 21 years of age, is so different. It's like, and when I've talked to moms who are in that same stage where literally I could choke that child out at 16, 17 years old, it's like, look, just wait. And it's, you gotta hold your ground. You gotta stand your ground. And it's kind of what I did. I wouldn't enable her. I wouldn't give in to her. And there were days that I didn't know if I was going to be able to make it through as a mom. Like what?
High school is really hard for just about everybody. I'm 59 years old, and I still have nightmares about stuff that happened in high school.
Well, did you see yourself what you look like in high school?
Yeah.
I'd bully you.
I was cool. My little Playboy shirt, my little afro.
I actually have a picture of Steve. It's pretty. I don't think he was in high school, but I think he was in his 20s, and he's wearing these little teeny tiny peach colored shorts with Ugg boots.
Yeah.
And it looks like somebody stuck a Tupperware bowl on his head. And it's one of my favorite pictures. I'll show it to you later when you want me to.
That was in style.
So, Doc, how much time do you spend seeing patients versus running your business? And in the running the business, how much of that is following sort of government regulations like reporting and tracking and insurance and all that?
Oh, my goodness. So insurance, I got a couple things to tell you about that. But so I see patients 4.5 days a week, and then I usually chart from home on average or take care of stuff probably an hour and a half to 2 hours a day.
Okay.
Which can be, after the kids are in bed, or if it's urgent, I'm taking care of it, while they're doing homework. And then I spend about an equal amount of time going through management decisions, strategizing for the future, putting out fires, dealing with patient issues, making sure the management team is kind of on their game. Mm-hmm. And, the insurance companies, when the Affordable Care Act passed, it was not really an expansion of healthcare. because what happened was I was in residency and I couldn't figure out why all these, Blue Cross Blue Shield, all the big players were up in Washington kind of making this thing happen and saying we're all for it. Mm-hmm. But if you do the math, you can't even do it on your iPhone and come up with the real number. But if you say 20 million new people and the average premium like 5 years ago was $245 or $246, $245 times 20 million per month of premiums that they're getting. And so what they did, and it was very noticeable to us in primary care, is no longer could I just make a referral for you. They would decline it. And then I have to get on the phone with them and prove up to them why you need to go see the orthopedic doctor because you have a fractured femur. And they would just not approve it until it was, you could clinically back it up. And so that was one. The other was there may not be a specialist. Like if you need a cardiologist, there may not be a cardiologist within 60 miles. Some of that's corrected, but essentially what happened, and I think we've all felt it in our health insurance, is like, gosh, this isn't really insurance.
No,
it doesn't.
I know.
I'm paying, a lot of people around here pay $5,000, $10,000 deductibles.
Yeah.
And on top of that are paying, $1,500 to $2,300 for a family of four monthly. And you're scared to death to use your insurance. Yep. It's just there for an emergency.
I was there being self-employed. I was, buying my insurance. I was paying $1,400 a month for terrible insurance.
Yep.
And where I couldn't even go see the doctors that I wanted to see.
Right.
Yeah, that was a mess.
So they were smart. I mean, they got ahead of it. They said, this is going to happen and we're going to figure out how to be on the winning side of it. And so that, they have shiny cards, great commercials, beautiful coliseums, and, unfortunately we battle them all day, every day.
Yeah.
And this is one of the areas where we get a lot of kickback from patients.
Like it's your fault. You're not the insurance company. Yeah.
Right. And they've got stricter and stricter protocols. Like if you come into my office and say that you hurt your back 6 months ago and you want to go to physical therapy, and I do a physical therapy referral, and their doctor that they're paying reviews the chart and you don't meet one of the 10 criteria, they decline it.
Wow.
And then to get it approved, we're needing to say, okay, we need to re-engage with the patient. So I've had a staff member working on getting it approved the first time for an hour or two. It gets denied. Then we find out why. Then we try to schedule with the patient so that we can cover all bases and get everything covered. And this is for physical therapy.
And that's per patient. So there's referrals and insurance issues per patient.
Denied medications, something I know somebody should be on that is the best medication for them in a specific disease process. But the insurance says, well, no, you have to try these other 3 meds first. I don't know what those 3 meds are because every insurance company has a different formulary. So you come in and I'm like, I want to reduce your cardiac risk because you have diabetes.
Right.
And this is the med I want to put you on. And you deserve to be on this med. You're paying these high premiums. You're doing all this. This is, you and I discuss the other treatment options and that's the one we decide on. You can't get that without a prior auth. And to get the prior auth approved, I don't know what 2 or 3 meds they want you to take and fail. And their term of failure is sometimes different than yours.
Yeah.
And so
then the insurance company is actually treating the patient, practicing medicine and treating the patient because you want them to do something else, but the insurance company forces them to go a different direction.
Right.
That's ridiculous.
They very subversively force them. It's through the pocketbook, right? They're like, we'll cover these meds for $5 a piece per month. But if you want that one, it's $500. So
that's the one. The one med I'm on is without insurance. I think it's like $3,500. Crazy.
So, Dr. Lewis, if you had like a magic wand and you could just wave it over the whole country and fix our healthcare system, what would you do?
Wow, I didn't think about that. I think there has got to be one of the things I'm most amazed at is that doctors have not lobbied as a huge group to have practices in place that are beneficial for the doctor-patient relationship and ease of processing.
Yeah.
I'm a very pragmatic guy. And so when you ask me that, I'm like, it's not, they're just too powerful. The insurance companies, it's not likely to improve significantly. What I do think we'll see is a transition of people moving into, more private like cash pay clinics.
Okay.
For their quality of care. Because people, I feel it just from my patients. Y'all can tell me, people are frustrated with their health insurance.
Oh, yeah. Without a doubt.
What else do we pay for in life that we have like very little satisfaction. You know, when you buy,
and pay so much for it. It's
Right,
not like it's $75 a month. It's hundreds and hundreds of dollars every month.
that's right. And so it's a interesting dilemma.
Do you think that the future of medicine is more towards the telemed, impersonal type doctor-patient relationship? Do you think COVID that kind of spearheaded that position of medicine? I thought it was so impersonal during COVID. If you tried to go to the doctor for something not COVID related, if you tried to go to the doctor not COVID related, it was very hard to try to get a doctor to put their hands on you during that time.
I think this is a very slippery slope. So I've been practicing for coming up on 12 years in my private practice. And for a year or two before that, when I was in residency, I got my license and was moonlighting. Physical exam is a critical component for almost every disease process. Now, if somebody, telemeds me and they're like, I was working out in the weeds yesterday and now I've got poison ivy, that's a fairly straightforward. Sure. But if they were in the office and you listen to their lungs and they have wheezing, then they're having some systemic response to that. And that might change you from putting them on topical steroids to oral and topical so that you can control the airway as well. And then there's patients that I've been doing general physicals on or seeing them for otitis media or ear infection, and I'm looking at their neck and I'm like, that is not a good skin lesion I see there. They have no idea it's there. But if they didn't have a physical exam in office, you're not going to see that.
Right.
And so I think there's a lot that can get missed. And one of the things that I've seen from people coming into my office for follow-up after doing a telemed and not getting better, almost everybody's given an antibiotic and a steroid. I mean, just right there, that is a scary practice in and of itself. Antibiotics are overprescribed. There's resistance in all bacterias. They're always working to figure out how to beat the drug. And if you give somebody a steroid and an antibiotic, you're covering like 2/3 of what it could be. And so you may have a good outcome a lot of the times, but it was probably viral. They didn't need the antibiotics. Right. The benefit they got was from the steroid and the anti-inflammatory effect. Or it was allergic sinusitis, and they get the Z-Pack, which has anti-inflammatory components, and the steroid pack. They feel better, but the antibiotic did nothing. It was not even in the playbook, really. So,
wow. Well, I know we're going to run out of time here. Tell us about Doctors Without Borders.
So I think that Michelle, my wife, may have given you misinformation. I've been down to Haiti several times privately with a close family friend of ours. And done healthcare for an orphanage down there called Mason. And then prior to that, we were going to Peru about once a year. I think I did 7 trips, and Michelle went with me like 4.
That wasn't Michelle. That was my own son, Logan, that said doctors. So don't throw Michelle in the bus.
Thank you. That's better.
I'm looking at the sheet. It actually says medical missions in Peru and Haiti. So we got
throw Logan into the
and
bus.
Those are fun, but we haven't been able to get back down to Haiti lately just because for safety stuff.
I know Logan was going to go with you at one point. He was really excited about that.
We had talked about it, and it's unique. After being on so many of these trips, you realize like the first trip or two, you go down there and you're going to save these people. The reality is a lot of them, other than the diseases they suffer from the way they prepare foods to bathing and using the restroom in the same area and washing their dishes in the same area. Beyond that, they're typically healthier than we are.
Really?
Because they're especially in the Amazon, they're farming. They're working every day. They go out fishing all day and farm in the morning and evening. And they're eating fish and plantains, and they're physically active, and they're not getting processed sugars. They're not getting all the stuff that we do. But it's fun to get down there and interact with the kids and see them light up and then do some things that have been life-saving in a lot of circumstances. But it's not as you get down there, you figure out the dynamics of it. It's like you're just there to love people and to give them a gateway to hope, and that's the biggest medicine that they get.
I think that kind of it's an extension of your ministry too. You've mentioned several times you feel like you were called to do this, aside from all of your medicine and going overseas, and what do you do for fun? Like what? I mean, what do you do for just
when you have time
when you
off?
have time?
So we'll spend a lot of time with the family, which is is a lot of fun for me. But for my individual like guy time, it would probably be play golf once or twice a year, fish once or twice a year. And when I play golf, I'm talking about 9 holes. I don't have the time to go play 18 or the bandwidth. Like I'm like 18 holes is gruesome, but I've got a bunch of buddies who are always inviting me.
Maybe you'll get invited to the new one at Discovery.
I already have.
Oh,
have you?
Several
times.
We've been out there. We were when they were building it.
Building it.
Yeah, it's
Well,
gorgeous.
you have to tell us how that is.
It's a
It
gorgeous
is.
course.
So that's one that's on my hit list.
Oh, I'm sure.
Sometime this summer.
Yeah.
So
Do you need a caddy?
Yeah. Well, the last question for you. What do you see in your future?
just keep doing what we're doing. Keep our heads down and have thick skin and always continue to serve people. One of the things that I had to realize over the last, I'm not as sensitive as I used to be to some of this stuff that we were talking about earlier. But, you just keep your head down and serve people and do the right thing and do everything you can to make it right. And then that's all you can do.
That's
so we're
right.
just going to keep doing what we're doing. We're trying to put providers at each location, and they are there that have that desire to help. And it's not about necessarily the finances behind it. It's about the ministry and the relationships you build in a community. Because after what comes with the relationships, in my experience in about to be 45 years of life, is if you have good relationships, everything else tends to fall into place.
That's true.
Whether it's finances, needing help with something, or having the influence to speak to a 17-year-old of a dad that trusts you 100% and mom that trusts you 100%. And now that door is open. They're like, Doc, you just spend time and talk with our kid and let us know what we should do.
Yeah. Well, thanks for being such a big part of this community and doing everything you do and spending this time with us. Thanks for coming in.
Thank you for having me.
Thank you, Kevin.
Yep.
This show is brought to you in part by the Mallett Integrity Team, serving Dripping Springs, Austin, and the surrounding areas of Central Texas since 2004. When you need the best real estate advice and service, give them a call at 512-829-2062 or email them at mallettintegrityteam.com.
Thanks for listening.
If you have comments or feedback, please email us at mallettandmichelle@gmail.com.
Follow us on Facebook and Instagram at Mallett and Michelle.
Listen to us on Apple Podcasts, Spotify, and Stitcher.
Please follow us and leave a review.
Thanks again for listening.